Hello everyone, I am Dr. Donald Ozello of Championship Chiropractic in Las Vegas, Nevada. Welcome to today's episode of Dr. Ozello's Sports Medicine Report. Prepatellar bursitis is also known as Housemaids' knee, Carpenter's knee, and Carpenter's knee. This is a fairly common injury among athletes, specifically wrestlers, where it is very common, and it is a recurring injury. The patella is the medical name for the kneecap. There are 4 bursas located in the knee. A bursa is a fluid-filled sac between 2 structures that helps to reduce friction. The 4 bursa that are located in the knee are the Prepatellar Bursa, which is what we're going to talk about today. That is in between the patella and the subcutaneous tissue, basically in between the patella and the skin. There is also the Pes Anserine Bursa, and then there is the Suprapatellar Bursa and the Infrapatellar Bursa. Prepatellar bursitis is the most common bursitis in the knee, and it is also the second most common bursitis in the body, following only olecranon bursitis, which is bursitis in the elbow. So again, the second most common bursitis in the body is prepatellar bursitis. The symptoms of prepatellar bursitis include pain and tenderness with pressure, and also warmth and redness. But the most common symptom is that pain and tenderness, especially felt while you are kneeling or putting pressure on the patella. The mechanism of prepatellar bursitis can be acute or repetitive. When it is repetitive, it is just a constant or repetitive kneeling, putting pressure on the bursa. Like I spoke about, it's common in wrestling. Think about how often wrestlers are kneeling. Also, the source can be acute. This is when there is a direct trauma to the patella, such as falling directly on the knee. Trauma to the bursa increases blood flow, migration of leukocytes into the bursa, and fluid production from within the synovial cells of the bursa. These provide the foundation of the inflammatory response seen in bursitis. Overall, the prognosis of prepatellar bursitis is very good. Prevention is the best tool. If you are performing any type of sport where you are constantly putting pressure on the patella, wear your knee pads, modify your training, do anything you can to prevent this injury. Be safe when you are training to try to prevent a direct trauma to the patella. Self-treatment of prepatellar bursitis includes placing ice on the area. Whenever you apply ice, you always want to make sure that there is a thin towel between the ice pack and the skin. You also want to strengthen all the surrounding tissues that need to be strengthened, and you want to stretch all the surrounding tissues that need to be stretched. Disclaimer alert, disclaimer alert. Viewing this video does not take the place of seeing a medical professional. If you think you have prepatellar bursitis, please see a medical professional and get the proper diagnosis. You'll get an evaluation, a diagnosis, and a treatment plan to set you on your path of recovery. Never perform an exercise, be it strengthening, stretching, or motion exercise that elicits symptoms or intensifies symptoms. If any exercise elicits or intensifies symptoms, please modify that exercise or skip it altogether and find an exercise that does not elicit or intensify symptoms. Thank you everyone for viewing today's episode of Dr. Ozello's Sports Medicine Report, where I covered prepatellar bursitis. Please feel free to like this video. If you have questions, feedback, or suggestions, please leave them in the comment section below. Please subscribe to my YouTube page, Dr. Donald A. Ozello, DC. I am Dr. Donald A. Ozello, DC of Championship Chiropractic in Las Vegas, Nevada. I am the author of Running, Maximize Performance and Minimize Injuries. You can visit my website, championshipchiropractic.com, where you will get more information on the book, and you can also find my blog. My blog contains numerous articles on sports medicine, health, fitness, chiropractic, and nutrition. Everyone always remember to train hard, but train smart. Give yourself adequate rest between training sessions. Utilize nutritional and supplementation strategies that work for you. Stay injury-free. rehabilitate your injuries and accomplish your